Good afternoon, everybody, and you're very welcome to today's UCD's Institute of Food and Health Research Bites. And today I'm delighted to welcome Sinead Omani. So Sinead works as a Senior Technical Executive in Food Reformulation at the Food Safety Authority of Ireland. She's a CORU registered dietitian and has an MSc in Public Health and Health Promotion from the London School of Hygiene and Tropical Medicine. Sinead is currently completing her PhD, and this is on the area of the healthiness of the food retail environment and food reformulation, and she's conducting her PhD at UCD. Before she joined FSAI, Sinead worked in clinical and humanitarian nutrition across Africa, the Middle East, and Central America. And it's an experience which gave her a passion to understand the factors that shape food environments and indeed the important topic of what drives food choice. So today, Sinead is going to talk to us about food reformulation in Ireland. So over to you, Sinead, and thanks very much for doing this today.
Thank you, Dolores, and thanks for the introduction and for the opportunity to present today. So as Dolores said, I'm going to present on food reformulation in Ireland, identifying priority food categories and investigating approaches to monitoring progress. And in the presentation, I'm going to really discuss how a PhD that I started in UCD has been able to be leveraged and built on to design and implement a reformulation program for Ireland. So to begin with, what is food reformulation? So food reformulation is defined by the World Health Organization as the process of altering the processing or composition of a food or beverage product to improve its nutritional profile or to reduce its content of ingredients or nutrients of concern. And so the idea behind food reformulation is to make small changes across a vast quantity of foods that improves the overall nutrient profile of the food, and that also has an effect on consumer dietary intakes, because if many foods have small changes and consumers are eating those many foods, those changes will build up in the diet and result in healthier diet overall. So in 2019, I registered with UCD to complete a part-time PhD, which was sponsored by the Food Safety Authority of Ireland, where I work. And this was to complete a PhD on an analysis of the Irish retail food environment and the potential for food reformulation to provide healthier food options. And my PhD is supervised by Professor Eileen Gibney, Professor Geraldine Doyle, and Nuala Collins. And the PhD has two main components. The first is looking at the overall availability of healthy and, I suppose, unhealthy foods or discretionary foods in the retail food environment. And particularly in this study, I was looking at supermarkets. And then of those discretionary foods, to look at the nutrition composition of the discretionary foods over time to see if their nutrient profile improves based on food reformulation. So in this presentation, I'm particularly going to focus on the process of looking at the nutrition composition of the foods. And I'm not going to discuss the piece on the availability of healthy and discretionary foods in supermarkets. So I wanted to show this diagram, I suppose, to give a deep dive into food reformulation. And this was a diagram that was produced by Gressier et al. In 2022. And it really gives an overview of what happens when food products are reformulated. So when a food product is reformulated, the original product is reformulated. And in, I suppose, the pure sense of reformulation, the reformulated product should replace the original product, but that's not always what happens. Sometimes the reformulated food is added to the market, and that means the consumer can potentially ignore the new product, or the nutrient profile of the product deteriorates. So even though it's reformulated, the profile actually worsens. So this, I suppose, center part here is the real pathway of what we would consider the ideal situation that happens when food is reformulated. So the next step then is the product marketing is unchanged. But what can happen is different sensory characteristics or different promotion leads to consumer over consuming or switching to another product. If the product marketing is unchanged, the consumers don't change their behavior as a result of reformulation. And that's the ideal scenario. And it means then that there's an improved nutrient profile of the diet overall. There's a healthier diet. But the consumer may overconsume or switch to another product, meaning the consumer compensates for the changed nutrient profile of the product. And so that means that there's an equal or worsened effect on the nutrient profile of the diet. And so that reformulation doesn't have the desired effect. If the improved nutrient profile of the diet, if there is improved nutrient profile of the diet, then it means there's reduced burden of dietary risk factors and disease. So this center pathway is really the pathway that we're trying to drive in food reformulation. But sometimes it can, these alternative pathways can divert the expected pathway and the desired outcome. So I started a PhD and one component of it was investigating food reformulation. And I suppose I'm just going to give an overview of some of the outputs of that PhD, which commenced in 2019. And these are the outputs up until 2022. So I completed a literature review on reformulation of processed yogurt and breakfast cereals over time, a scoping review, and this review was published. And in compiling this review, as everyone I'm sure is aware, we collected a huge amount of literature, and that literature actually proved really useful in then when we got to the point of developing a food reformulation program for Ireland, or I suppose I should say implementing the implementation approach, developing an implementation approach for a food reformulation program in Ireland. The next thing I did as part of the PhD was identify food categories for nutrition composition monitoring. And so to do that, I reviewed the approach used to identify priority food categories for reformulation monitoring in other countries. And that led me to request access to NANS, so the IUNA National Adult Nutrition Survey. And this was analysed to determine the food categories which were the largest contributors to energy, sugar, fat and sodium intake. And based off this, and really driven by food categories that contribute to sugar, 8 food categories for nutrition composition monitoring were identified for monitoring in the PhD. And with funding from Insight and the FSAI, I established a pilot branded food database by adapting CLASS, which is a system used in Slovenia. So CLASS is a branded food database used in Slovenia. And this was adapted for use in Ireland in partnership with the 2 lead researchers, Professor Igor Prafs and Masha Hribar. And this pilot branded food database was rolled out to collect nutrition composition data from 3 large grocery retailers in Ireland who agreed to participate in the study. And the summary of the products that were collected in this table here, but overall there was 2,200 products collected. Data collected which will be used in the PhD was also used to develop 2 reports, one on reformulation of yogurt, looking at the accuracy of nutrition declarations on food labels for the monitoring of food reformulation in Ireland, and a second one on breakfast cereals, looking at the accuracy of nutrition declaration on food labels for monitoring food reformulation in Ireland. And these reports, the data collected for these reports will be further analysed for a publication as part of the PhD. And these reports have been used to inform the monitoring approach for the food reformulation programme in Ireland. So then in 2019, a roadmap for food product reformulation in Ireland was published, and that was published based on Action 3.3 of A Healthy Weight for Ireland Obesity Policy and Action Plan. And to implement that roadmap, the Food Reformulation Task Force was established, and that task force is led by Nuala Collins, and I'm working on that task force with Nuala and my other colleagues, Aideen, Michael and Sarah. And the task force was established in 2022, so about 3 years after I commenced my PhD research. And the task force aims to drive reformulation and to drive nutrient reductions by reducing sugar by 20%, saturated fat by 10%, salt by 10%, and calories by 20% in processed packaged foods that are key contributors to these nutrients in the Irish diet. So when deciding on the best approach to take when implementing the roadmap for food product reformulation, we were able to leverage some of the approach taken to completing my PhD. And the first one was to leverage the approach taken to identify food categories for priority food categories for reformulation and for monitoring. And so I'd outlined earlier that I had looked at how other jurisdictions had done this and then analysed the NANS data, which I was given access to by IUNA. So we decided to broaden that analysis, and we commissioned a analysis of all of the IUNA data sets, not just adults, but also the preschool children, adolescents and adults data sets. And we commissioned an analysis by IUNA led by Dr. Breege McNulty to do that. And that resulted in this report, Food Reformulation Task Force Priority Food Categories for Reformulation in Ireland, which is available on the FSAI website. And that approach identified 40 priority food categories for nutrient reduction in Ireland. And these are summarised here, but are also outlined in detail in that report that I showed. The next thing we were able to do was leverage some of the research completed in the PhD for monitoring the nutrition composition of particular food categories. So as I outlined before, as part of the PhD, I completed a market snapshot in 2022 of those 8 food categories. And these food categories will be used, or the information collected by these food categories will be used by the Food Reformulation Task Force as part of reformulation monitoring in Ireland. And that's outlined in this table here, which is published in the Reformulation Task Force Progress Report, which is available on the FSAI website. We were also able to commission a number, or to undertake a number of discrete research projects to address evidence gaps identified by the task force, and they were able to be completed using data or methods identified in the PhD. So the first one that we completed was an investigation into the accuracy of nutrition declarations on online retailers. And that was completed by a 4th-year BSc student, Michael O'Neill from TUD. And that used some of the data collected as part of the PhD, and also some web scrape data that was collected during the same time period as we went out to the shop, so we could complete that comparison. Another study which was undertaken was monitoring food reformulation using the minimum essential food basket. And that was led by Eve Lynch, who's a 4th-year student in nutrition in UCD. And that study is providing us with, or I suppose is a feasibility study looking at the potential for monitoring how food reformulation affects people in different socioeconomic groups, and to make sure that we're not having any unintended effect on social inequalities by encouraging reformulation of food products via changes in price or access. And the third study was monitoring nutrition composition of gluten-free foods, establishing a baseline, and that was led by Adele Campbell who's a fourth year BSc nutrition student in UCD. And that was to take a particular look and focus on gluten-free foods to investigate if they require any additional food reformulation targets or goals based on their differing nutrient composition to gluten-containing foods. And finally, we were able to leverage the network developed during the PhD. So as I said, with funding from Insight and FSAI, we established a pilot branded food database in partnership with researchers in Nutris in Slovenia by adapting their class tool. And so we arranged an information exchange for Masa Hribar to come and visit and share their experience in establishing and maintaining a branded food database and monitoring the nutrition composition of the food environment back in September last year. And Masha also gave a presentation which was arranged by the Institute of Food and Health in UCD. So that's an overview of, I suppose, how the research that was completed as part of the PhD was able to be leveraged when it was time to develop an implementation approach for the roadmap for food product reformulation in Ireland. And further information on food reformulation in Ireland can be found on the FSAI website. And you can also scan this QR code. And there's different, I suppose, resources on the website. There's access to all our reports, and there's also recordings of webinars on how defining the food categories and setting a baseline was undertaken, and also a more recent webinar on food reformulation industry queries. So thank you for your attention. And again, thanks for this opportunity to present, and if there's any questions.